Well, our GLE is at Lakeridge Health this morning, learning more about Ontario Hospital's Split the Pot lottery.
Okay, and we say hello to G this morning. G, how's it going so far? I know it's still pretty quiet, but tell us more.
Good morning, Jen. Good morning, Nick. Yes, so Split the Pot is a lottery that allows you to buy tickets, win incredible prizes, but also giving back to 62 hospitals, one of them being Lakeridge Health. And we are here in Oshawa. This is a beautiful facility, by the way. And we are joined by CEO Eve Gadler with Lakeridge Health Foundation. Good morning.
Good morning. How are you?
I know, a beautiful, bright, sunny day. Tell me a little bit more, first of all, about Lakeridge Health.
Right. So Lakeridge Health consists of 5 hospitals across pretty well all of the Durham region, from the east in Bowmanville to the west in Ajax-Pickering. And we are here this morning in beautiful Oshawa. And it's, the Lakeridge Health provides pretty well services to the whole community from basic level to tertiary levels. Here in Oshawa in particular, we have the R.S. McLaughlin Durham Regional Cancer Center, and it plays a vital role in the healthcare needs of our community.
Yeah, especially this area, Durham region is growing fast and furious.
Very much so, very much so. We have, over the next 10 years, we expect to be easily over 1 million people. Oshawa itself and Whitby, the foundations that we serve, are growing communities, and as you might have heard last week, 2 weeks ago, the provincial government made some major announcements enhancing healthcare services here in Durham and here in Oshawa, but also a new hospital in Whitby.
And the reality is it's really important to invest in healthcare, and that's one of the reasons why 62 hospitals have rallied together to do a split the pot lottery like this. Tell me a little bit more of why that's so important.
It's so important because it provides support to such vital needs in the hospital, from our equipment capital projects that are not funded by the government but are provided, supported by either private support or things like Split the Pot. Educational research needs. Just 2 examples from us this year. We supported robotic surgery at Lakeridge Health Oshawa. We are just about to have CT PET coming to Oshawa. This is vital because there's no CT PET services between Toronto and Ottawa at the moment, so this is going to be important for us here to provide that kind of service here, close to home for our patients and their families.
Yeah, and then this is the largest hospital foundation partnership, right? Which I love, because if you buy a ticket, you have a choice of which hospital you want to donate your money to, or you can give to all 62 hospitals.
Absolutely, and that's vital, right? I mean, it's so important that people can give to their local community hospital or support the whole hospitals across the province.
Yes. Okay, and it will make a difference, right? I guess every dollar does make a difference.
Every dollar makes a difference. Every dollar that we get here will go towards that vital equipment needs that we need to care for our patients and their families.
All right, Eve Gadler, thank you so much for that. And this jackpot, this payout for Split the Pot is expected to grow to $1.2 million. So we're talking about straight up cash. Eve, I've always said my favorite prize is cash.
Cash is king.
Cash is king, cash is queen. You've got it. So there will be 13 grand prize winners, and basically how it works is one winner will go home with 60% of the grand prize, 2 winners will split 20% of the grand prize, and 10 winners will split 20% of the grand prize payout. So get your tickets, they start at $20, splitthepot.ca. Good morning. We are here in Oshawa at Lakeridge Health, and we are here downstairs inside the radiation therapy area. It's to give you an idea of this lottery that's taking place. It's called Split the Pot, and basically when you buy tickets, money raised through this lottery will go to 62 hospitals in Ontario, including Lakeridge Health. Joining me now is Dr. Peter Dixon. Hi, good morning.
Good morning.
Yeah, so you are the Chief of Oncology and Medical Director. We're here in the radiation therapy area. Tell me what's happening here. What kind of machine are we looking at here?
So this is a piece of equipment called a linear accelerator, and it's the core machine that we use for delivering radiation treatment for treating people with cancer.
And obviously there's no radiation taking place here because we're in the room, but I just want to give our viewers at home an idea. When a patient is lying here, what is exactly happening?
So patient lies quiet and still, and the role of the radiation unit is to deliver the radiation treatment where we want it to go and avoid where we don't want it to go. And to do that, this unit can offer
Yes.
Sorry, I'm sorry. It can point the beams from multiple different directions, so that we have a well-covered tumor and not treating tissues elsewhere.
Yes. Can I ask, I know this is the latest and greatest. 10 years ago, what did the technology look like, and what's the difference now?
It looks similar, and the basics are the same, but there have been so many advances in the hardware and the software that allow us to conform the radiation treatment more to the tumor and less to the normal tissues, that it allows us to give bigger doses to where we want it to be, and that improves outcomes in terms of controlling cancer and minimizing toxicity elsewhere.
Yeah, so I know that Durham region is a growing region. How many patients are you seeing coming through here in the cancer center?
Well, in terms of radiation treatment, there's about 3,000 in each year. The total number of treatment sessions that we deliver is between 30 and 40,000.
Wow, it's that busy.
Yep.
So money raised through a lottery like Split the Pot, every dollar goes back to healthcare and helping patients.
Right. So we have great support from the government, from the province of Ontario, in terms of replacing equipment that's become obsolete or just wearing out. But the community support through the foundation is very important to enable us to complete the job optimally. There are certain amounts of funding that has to be raised locally, and the community here in Durham has been fantastic over the last 30 years, actually, in providing that support. And they were critical in actually getting the cancer center open in 2007.
Amazing. Thank you so much, Dr. Dixon. We really appreciate you joining us. Thank you so much. So again, you can make a difference. Tickets start at $20. This is called Split the Pot. For information, splitthepot.ca. It's straight up cash, which is a great prize. And basically how it works is there's one grand prize that's expected to grow to $1.2 million. So one winner will take home 60% of that. 2 winners will split 20% of it, and 10 winners will split 20% of the jackpot. So again, splitthepot.ca. They're expecting the jackpot to hit about $1.2 million, and basically money raised is going to go to 62 hospitals in Ontario, including right here at Lakeridge Health. And we are inside the R.S. McLaughlin Durham Regional Cancer Center, learning a lot about all the incredible work that's taking place here at this facility. And joining me now is Dr. Kwan here at Lakeridge Health, who is a nuclear medicine physician. Good morning.
Good morning. Thank you for coming.
Thank you. So tell me, I know Durham region is a growing area. You get a lot of patients coming through. Tell me a little bit about the cancer center here.
So the cancer center is really benefit the community, so the patient don't have to travel to Toronto or elsewhere to get their investigation or their treatment. So we see a lot of cancer patients coming through, or a variety of them, lung cancer, lymphoma, and others. Mm-hmm. So they all get most of the testing done here, and on the treatment, chemotherapy, radiation, they get them all done here as much as possible.
Yeah.
But unfortunately, some procedures need to be done elsewhere, okay. And that's why we are very fortunate to have our PET CT scan coming online soon.
Yeah, so let's talk about this. This will be home to Ontario's newest PET CT scan. What is that? A
PET CT scan is a combination of a PET scan and a CT scan. So most people are familiar with a CT scan. Mm-hmm. It gives us a very good look at what's inside our body, where we get a lot of details. But a lot of time we don't know how things are functioning inside our body. So that's why the PET the PET scan comes in. So it tells us, we look at things at a cellular level and how the cells are metabolizing certain substances, yes, or receptors. And by doing that, we could tell how the cells are functioning. So it gives us more information. And by combining the two with the detail of how things look inside our body and how it functions, it really benefits us how to treat our patient, because we could tell a lot more about the patient, what kind of what stage of disease they're at, and would tailor our treatment accordingly.
Okay, Dr. Kwan, thank you for explaining that. And we do have a former patient here, Mark Gibbons. He is not only a former cancer patient, but as they say, a PET CT frequent flyer. here. I like the humor involved, but tell me a little bit about your cancer journey, because it's been a long haul for you.
Good morning. It has been a long haul. I was diagnosed in 2019 with Hodgkin's lymphoma, and the plan was chemotherapy, radiation, and in the middle of that, we threw in a pandemic. So that made things extra spicy here at the Durham Regional Cancer Center. And unfortunately, I relapsed in 22, and so had to go through it again. It included a stem cell transplant, and then another year of chemotherapy. And I'm pleased to announce that this week I'm celebrating 1 year out of treatment. So celebrating a PET-CT coming to the Cancer Center here, as well as the completion of treatment.
Well, first of all, congratulations.
Thank you.
You are a warrior. That second relapse, how challenging was that for you?
It was devastating. You know, when you hear the word "you have cancer," that phrase, it's devastating. For me, it was even harder the second time. But there's a sort of dual nature to it, and for me, given the odds of, pretty positive, it was an opportunity for self-discovery and transformation. So, it's been an incredible journey. I'm doing really well today, prioritizing health and fitness, and helping in whatever way I can here at the Cancer Center with fundraising, and also just speaking out about the importance of staying fit and healthy, and hopefully remaining cancer-free.
You know, Mark, I really appreciate you chatting with us, because it's really those personal stories that are going to make a difference for people watching at home.
Absolutely.
We know that cancer touches everybody. I have friends who are fighting it right now. My mom is a cancer survivor, so I thank you so much for sharing the story. And really, at the end of the day, this is what it's about. When you give back to the hospitals, you make a difference for patients that are coming through with new technology, new treatments, all of that. And you can do that with Split the Pot lottery. Tickets start at $20. For more information, splitthepot.ca. Again, that money goes to 62 hospitals, including right here at Lakeridge Health. Mark, live your best life.
Thank you.
I am so happy for you.
It was nice chatting with you today.
Yeah, so we're getting a really cool tour here at Lakeridge Health in Oshawa. It's one of 62 hospitals participating in Split the Pot. There is an early bird deadline tonight, so you want to get your tickets before midnight tonight for your chance to win $1,000 among 7 lucky winners. So they will split $1,000, but that's not even the grand prize. I'll get to that in just a sec, but I do want to bring in Yves Gadler. He is the CEO of Lakeridge Health Foundation. Hi, good morning. So in our last segment, we had a really powerful conversation with a former cancer patient, and that's what this is all about, investing in healthcare and really saving lives.
Absolutely. You met Mark, young man, young family. Had to go out of the area to get CT PET treatment service. So bringing that service here close to home is, what we do as a foundation here. It's important that we have services throughout the province, regardless of where you may be. And so to bring that here was vital for us to ensure we had that care for our patients and families. And, again, when we think, and I was seeing what you were talking about earlier, right? Like, we're all touched by cancer, you're absolutely right. And it just becomes even more challenging when you see it's a young person. It's not just, cancer's not just a disease for, people that are older. It affects everyone. And so we're just delighted to see that Mark's doing well.
Mark is doing well. We're celebrating his wins. But that's the whole point, investing in healthcare. You have an area here, Durham region, it is booming.
It is booming.
And so we need to invest in equipment and healthcare here so that they don't have to travel a long ways.
Exactly, right? I mean, there's certain services that are always going to be, on the university corridor that are vital. But, providing services throughout the province at local community hospitals is something we're trying to do. So not just here at Lakeridge Health Oshawa, but throughout the province. We don't want to duplicate services, but something like that, or I was mentioning earlier this morning, a robotics program, again, something that's been around for a while, and to be able to bring it here to Durham means that we don't have patients having to go into town, and we all know about some of the traffic issues that we have in the greater GTA. So this, and let's face it, when you're a patient or family, and you're going through this traumatic type of journey, to have to go, stuck in traffic is probably the last thing you'd want to have to do. So to be able to do this close to where you live, it's just remarkable.
Really quickly, this is a linear accelerator. It's your first time seeing this actual
this version, yes, which we supported. Yes.
It's amazing how advanced technology has become, and it's making a difference not only for the staff here, but for the patients as well.
Absolutely, but you bring up a good point too. I mean, we always think of the patients and families, but it's important that the staff have the very best that they can, make sure that they have the tools to make sure that they're saving lives.
Yeah.
And this is a perfect example of this. These things require changes every 10 years or so. It's like, I was talking to the donor one day, and I said, how many smartphones have you had in 10 years, right? So to have the latest technology, we have to replenish that. We have to always rejuvenate stuff, and this is a perfect example. I'm not sure how many patients we see on a daily basis, but we use it pretty well to the capacity and maximum.
For sure. Listen, healthcare workers are heroes. I've always known that. I've always said that. We've got a hero right here. Thank you so much for showing us the Linear Accelerator. Cool name, by the way, right? And again, this is what Split the Pot is all about. It's about you having a chance to win some incredible prizing, which is all about cash, but also that money goes back into the local hospitals of your choice or for all 62 hospitals involved. Splitthepot.ca is where you buy your tickets. They start at $20. And get this, the grand prize is expected to go to $1.2 million. And this is what's going to happen. One person is going to win 60% of that jackpot. Two people are going to split 20% of that jackpot. And then 10 people are also going to split 20% of that jackpot. So it's a win-win-win for everybody.
Everyone wins.
Yeah,
absolutely.
And the main thing is it goes back into our healthcare system, helping staff as well as patients. So splitthepot.ca is where you want to buy those tickets. Thank you so much for this incredible tour.
Thanks for coming to Lake Ridge Health, Oshawa.
Thank you.